Good morning, Uganda team. This is Dr. Mike coming to talk to you again and give you a little bit of educational video. Today I thought we'd talk about the 13-year-old patient that we saw who had difficulty walking and turned out to have symptoms that are characteristic of acute rheumatic fever and a condition called Sydenham's Chorea. And so let's dive into that and talk about that a little bit today. So you can see from this video that she's having a hard time walking, that her motions are uncontrolled, and she's having trouble with arms and legs. Her arms and legs are moving on their own without her directing them. They are making random motions and making it much more difficult for her to walk. We call this choreiform motion, and it's frustrating. Really quite frustrating for the patient. Now there are different conditions which can cause this, but today we're going to talk a little about rheumatic fever, which is one cause of choreiform motion. Rheumatic fever is caused by a previous group A strep infection, and here's a couple of examples of strep infecting the throat and could present with sore throat and fever, and so consequently these should be treated with penicillin or similar to eradicate the strep. Now strep can also infect the skin, and so here's a little boy who has impetigo, which is actually a strep infection of his ear, and this picture was actually taken in the Bundabujo area. Now, not all strep infections result in rheumatic fever, but a small percentage of them do, and that's where the reaction to the strep germ actually begins to attack other organs in our body. So it's our own immune response attacking our body. So when our body's immune reaction begins to attack part of our organs, like our heart or our brain, we can have troubles with aortic regurgitation or mitral regurgitation, or in this case, the choreiform motion, which you saw. This picture was taken from osmosis. You actually have a great video on osmosis that you have access to. So look up the osmosis video on rheumatic fever and review it. I think that would be very helpful. The osmosis video on rheumatic fever is only 6 minutes and 34 seconds, so I think you can look at that video as soon as you're done with this one. I want you to be sure that you get her started on the prophylactic antibiotics, because if she gets another strep infection, this condition could definitely worsen. It's also very important to listen to her heart and get an echocardiogram, which is an ultrasound of her heart, to be sure she doesn't have the aortic regurgitation or mitral regurgitation, which can sometimes go along with this. Now there's a great video on aortic regurgitation and how to recognize it with a stethoscope on the Stanford 25. And so I would say you might want to look at that one too. It's about 9 minutes long and won't take you very long. So that's it for today. Like I said, I've been praying for you. I hope things go well. Let me know how things are going, and feel free to email as you need to. Great case. Good to talk to you again. Love you much. Bye-bye.